Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thanks for joining us again. Going to be speaking with Mr. Beto Casellas. He's CEO of CareCredit. He's joining us here to talk about financial implications of COVID-19 on hospitals, health systems, and patients. Welcome to Health Professional Radio, Beto Casellas.
Thanks, Neil. Great to be here.
A brief bit of your background and then talk about your role briefly there as CEO of CareCredit.
Sure, Neil. I lead CareCredit, which is a part of Synchrony. And basically what we do is we offer patient financing to millions of customers across the United States. We have a network of about 250,000 healthcare providers that basically accept our credit options. And basically our customers are able to use CareCredit to pay for the care that they need when they need it, and bringing forth flexibility of payments for being able to take care of their out-of-pocket expense.
As far as paying for health care, that's always been something that has been tweaked for decades by different providers, underwriters. It's always been front of mind how to make payments more efficient. Has COVID-19 thrown a much more challenging environment at you?
Yeah, I mean, Neil, it certainly has been a big change in terms of some of the trends that we see. It has brought forth to the forefront to many consumers out there in terms of how to cope and be able to pay for healthcare. Over the years, the amount of out-of-pocket expense due to high-deductible healthcare plans continues to increase. And really, consumers are looking at spending in healthcare as if they were doing other parts of their daily lives, like buying clothing, choosing where to go for their food, and different needs that they have every day. And so therefore, being able to afford taking care of yourself and procedures that are planned or needed to take care of your health, the question of how to pay for it is coming up a lot more. And so we provide flexibility of payments and different payment options to be an avenue for, first of all, consumers being able to have that flexibility. And then number two, the healthcare provider itself or the health system being able to have an avenue where they can offer this type of financing to consumers and patients, and therefore be able to mitigate some of the burden that comes with collecting several bills from hundreds or perhaps thousands of patients after service is rendered.
How are you able to offer the flexibility that you speak of, especially during this pandemic, and still maintain your efficiency?
Yeah, no, it's been over 30 years we've been offering this on multiple segments in the healthcare industry. And we have multiple products that basically offer the flexibility through deferred interest promotions, through equal payments, across a specific amount of time. So instead of paying the $800 or $1,000 bill immediately after the service, by paying with CareCredit, you're able to extend that payment over 6 months, 12 months, 18 months, in many cases not paying interest if you pay in full, and being able to do that. The provider, the advantage of the provider is they get their money within 2 days of that service. And then the consumer is able to extend that large bill that they may have gotten in being able to do it over a period of time.
Now, I understand that CareCredit conducted a report prior to the pandemic. Did you find that needs were addressed more from providers giving you information or more from trends that you were seeing in your various reports?
Yeah, I mean, we speak to consumers every day. And in this study, really found that about 43% of the patients have changed their behavior due to healthcare costs. And so what that means, Neil, is they either decrease or delay the care. They either don't fill their prescriptions, they don't fully comply with the recommended treatment plan, or they choose to postpone certain things that they could have done at that time if they had the option to be able to pay for it and perhaps pay for it over time. And so basically COVID brought forth even a bigger burden into the American consumers because they're concerned about the COVID and afraid of that piece. Going to a doctor seems difficult for them to imagine in the heat of COVID. I think providers have done an incredible job in making consumers and patients feel comfortable coming to their offices. The waiting rooms are a lot different, meaning in the sense that you don't see that many people there. There may be one or two patients. They're being monitored when they come in. They're being pre-checked and pre-screening before they come into the office. They're obviously cleaning much more. They used to be a clean, very, very clean operation, but they clean a lot more. And everyone is wearing personal protection equipment across their visits. So, again, we find that COVID sort of ignited and exacerbated the concerns they already had around the economic impact of paying some of these. And obviously, we've been able to do some things to continue to support both our provider network and also our consumers.
During this pandemic, as you offer these various options for payment over time, no interest and things of that nature, let's say that COVID-19 is defeated. We come up with a vaccine and things get back to normal. Do you think that you as a provider or the industry as a whole would begin to scale back on some of these programs that have offered some really, really great options, but only for the pandemic?
You know, I believe that when you say the new normal, I think it's going to be an interesting new normal, Neil, in the sense that we'll have the background of COVID very much in the background of what we do and the orientation of what we do. And so some of the trends that we are seeing around telehealth and telemedicine, I think those are very favorable because you have a better experience for the patient, being able to have a pre-visit per se over the phone or over teleconference with their provider, discussing their situation, and then really focus the visit on treatment and diagnosis from that standpoint. And so those trends are going to continue to be. I think from a standpoint of payments, we feel that some of the things we have put in place are going to take on. For example, we invented or created a specified QR code in each of our providers' offices for consumers to be able to scan that code, learn about CareCredit, apply on the comfort of their own device, and really do it in a contactless way. We expanded that capability. COVID helped us focus resources to be able to include payments into that capability so that patients in the comfort of their own home, in the comfort of their own device, rather than using a phone device or using paper or contacting in front of other people, being able to pay bills and things like that through their own device, through their own mobile device. So I think those kind of things are going to continue to explore. We'll continue to invest in those because we think the experience of that patient through the journey of setting up an appointment, going to the doctor, going to the provider, and then knowing what to pay and pay for service will continue to stay after COVID. And we believe that we're in a very unique position to continue to support that across the industry.
Talk briefly about some of the concessions for unexpected medical expenses. I mean, they were always a possibility, unexpected expenses, but now with COVID-19, that has been greatly compounded.
Yeah, I mean, from a standpoint of how healthcare gets spent, I mean, obviously there is Medicare and Medicaid, and of course, third-party payers and insurance. And unexpected expenses occur because there is an element of the out-of-pocket expense that we spoke earlier from that standpoint. Given that flexibility, whether, I would recommend to consumers out there, if they do have some plans like this, is to open an HSA or an FSA account. Those are health savings accounts that help you save for a rainy day or for an unexpected expense. But giving other options like CareCredit to be able to offer financing and flexibility of payment for consumers to pay for unexpected expenses is another avenue. And so all of these complement consumers having choices on being able to get the care that they need when they need it.
Beto, give our listeners a website where we can learn a lot more about CareCredit and the options that you offer.
Sure, Neil. Thank you. It's www.carecredit.com.
Right. Well, I appreciate you joining us here on Health Professional Radio this morning.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Beto Casellas, CEO of CareCredit. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.